Thomas Hergert is a golf course superintendent. His busy season is right around the corner, so he knew he needed help, and he needed it now.
I was having troubles whenever I extended my arm. I was in a lot of pain. I couldn't lift anything. I was even as bad as I couldn't lift an ink pen off my desk one time. That's how much pain I was in. I'd just drop it. And it was the stretching out that really made it hurt.
That's why Thomas came to orthopedic specialist and Dr. Tyson Cobb. Dr. Cobb is a hand and upper extremity specialist and is the only surgeon in the area performing a relatively new procedure that he knew could help Thomas.
Thomas had pain for about 7 months or so, and he sustained a work injury last July and had been on restrictions. At the time I saw him, he was still restricted at work, and none of the normal conservative treatments had helped to date, and so we talked about this new minimally invasive procedure, which is promoted as allowing for a faster recovery and allowing workers to get back to work and use their extremity without restrictions. And he was interested in pursuing that, and we did, and he had a very good result. And he's 11 days out today, and he's back to full duty and hasn't had any pain at all.
We were in the operating room with Dr. Cobb and his team when they performed that procedure on Thomas. This was just a month ago.
The day after, the day after the surgery, I felt like using my arm. I was told to not move it for 5 days, but it was hard to do because it felt so good.
It was originally developed for removal of cataracts, and it emulsifies the abnormal tissue and removes it. So a small probe is inserted through a very small incision. It's small enough that we don't even have to use a stitch to close it. We close it with a steri strip on a little piece of tape. And that high-frequency ultrasound probe breaks up the abnormal tissue, and then it's removed. And this allows for regrowth of normal tissue and healing.
And the procedure is over in just minutes.
Well, it's an outpatient procedure. We do it under a local anesthetic. It requires no stitches. And for many patients, they have no postoperative pain and they have very rapid recovery. I think those are the highlights of the procedure.
Thomas is a prime example of the success being seen with the procedure.
It's markedly faster. I don't ever recall seeing a patient after an open procedure come back for the postoperative visit, the first postoperative visit, and report absolutely no pain at all. So he iced the extremity only because I instructed him to do so. He told me he had no pain whatsoever after the procedure, and never took a pain pill. And to be honest with you, I wouldn't have believed it if I hadn't actually seen it myself. His strength is back, his full range of motion, he has no pain.
It's fantastic. I just never thought it'd be as successful as it is, because I have, when I was done, I had a couple Band-Aids on my arm. I mean, that's all there was to it. The alternative is, I guess, about a 6-inch cut in your arm to repair a tendon, and one little dot is nothing to worry about.
Getting Thomas back to work pain-free in a remarkably short amount of time. Reporting for QC Family Focus, I'm Mike Mickle.